The European Medicines Agency, EMA, has warned that the damage caused by its relocation from London would at best take 2 years to fix, and at worst led to its complete breakdown and a major public health crisis for the continent. A survey by the EMA asked staff to give their thoughts on the 19 candidate cities that applied to host the health agency after Britain's withdrawal from the EU in March 2019. The candidates range from Dublin, Amsterdam, and Stockholm, which are among the favorites, to Bucharest, Warsaw, and Zagreb, which are regarded as outsiders. The results revealed that, in the case of the 8 least popular possible new locations, staff retention rates could be significantly lower than 30% and as low as 6% in the case of one of the unnamed cities. The EMA said a move to any of these cities would mean it could no longer operate, ensuring no new medicines could be authorized. The EU would have to rely on medicines imported and approved from companies and agencies in countries such as Japan and the US. A report from the EMA suggested that such a public health crisis would mean permanent damage to the European system and that patients would be exposed to side effects including deaths and litigation. The best-case scenario, if one of the 5 candidate cities most popular with staff were chosen, would still be worse than the status quo, with staff retention, depending on the city, between 65% and 81%, leading to possible delays to the approval of new medicines. Progress on a number of public health initiatives, egg support to initiatives on antimicrobial resistance, and for the elderly, cooperation with health technology assessment bodies, will move at a slower pace, the EMA said, adding that it would take 2 to 3 years for the agency to recover. For the potential hosts ranked 6th to 10th, only 51% to 60% of staff would be retained, resulting in delays to new medicines, an erosion in public trust and potentially the loss of Europe's cutting-edge and scientific research. In the case of one candidate city, which scored a likely staff retention rate of 48%, there would be a serious risk of delays to medicines, a possible shortage of life-saving medicines, and a breakdown in cooperation within the EU, leading to inequality of outcomes for citizens. It would take 5 to 10 years for the agency to recover in this scenario.